We're sleepwalking into a preventable tragedy. That's the blunt warning from Israel's top infectious disease doctors as new COVID-19 variants, nicknamed Nimbus and Stratos, race across the globe. But here's where it gets controversial. While headlines scream about mutant viruses, the bigger danger may be our own collective shrug. Let's unpack what's really happening. First, the variants themselves. Nimbus, scientific label NB181, and Stratos, XFG. Sound like Marvel villains, but Professor Tal Brosh, who chairs Israel's National Epidemic Response Team, insists the dramatic branding is mostly marketing. Yes, these strains spread faster. Think of them as the sports car versions of earlier viruses, but there's no solid proof they're deadlier. In other words, they're speedier, not necessarily nastier. So why are hospitals filling up again? Dr. Yossi Ben Michael, an ENT specialist at Clalet's Remes Clinic, points to a deceptively mild signature symptom, hoarseness. Patients with the Stratus variant often arrive complaining their voice has turned into a croak. Add a scratchy throat, dry cough, and occasional laryngitis, and you've got the typical presentation. Treatment is comfort-focused. Lozenges, throat sprays, maybe reflux meds if acid is irritating the vocal cords, and most people bounce back within 14 days. The catch? If swallowing or breathing becomes difficult, it's a red flag moment that demands urgent care. But Brosh stresses an uncomfortable truth. You can't eyeball a variant. Sore throat, hoarseness, cough, these are the same symptoms you'd get from a common cold or flu, he says. Without genomic sequencing, it's impossible to tell which virus is camped in your airway. And this is the part most people miss. The variants aren't the headline. Our indifference is. Brosh paints a sobering picture. Every single day, Assuta Ashdod admits at least 3 new COVID patients. Larger medical centers report even higher numbers. The pandemic has settled into a relentless rhythm. Quiet months, brutal months, but it never truly leaves. Meanwhile, the public conversation has moved on. Now for the statistic that stunned even seasoned epidemiologists. Fewer than 1% of Israelis rolled up their sleeves for a COVID shot this year. That places Israel near the bottom of global vaccination charts. A dizzying fall for the country that once led the world in early pandemic response. Compare that to Scandinavia, where roughly 70% of adults got vaccinated in the past 12 months, or the United States at over 40%. Why the collapse? It's a perfect storm of vaccine fatigue, lingering mistrust after the government's 2021 Get the Shot or Else campaign, a collective yearning to turn the page on COVID, and the all-consuming focus on regional conflict. Booking an appointment has also become harder. Supplies are tighter. Clinics are booked, and the urgency has evaporated. But here's where opinions split sharply. Some argue that if the virus is now just another respiratory bug, annual boosters for the general population are overkill. Others counter that abandoning high-risk groups is ethically indefensible. Brosh lands firmly in the second camp. For anyone 65 plus or living with chronic illness, an annual COVID vaccine is as vital as a flu shot, he insists. The data back him up. In the past year, 1,800 Israeli adults were hospitalized with COVID. 74 needed intensive care, and 276 died within a month of diagnosis. Most were elderly or medically vulnerable patients whose existing conditions spiraled after infection. Young, healthy adults? The benefit-risk equation is murkier. Vaccination can still curb infection odds and reduce the chance of passing the virus to grandma, but the personal payoff is smaller. Brosh's pragmatic take, if you're 25 and fit, you'll probably shrug off COVID like a bad cold. Still, the shot is safe and might spare you a week in bed. Medication matters too. Paxlovid, An antiviral pill taken at home can flip the script for high-risk patients, yet only 275 courses were dispensed nationwide last year. Brosh shakes his head. We have tools, but we're barely using them. His closing plea is measured, not alarmist. COVID isn't going to vanish. It will keep ebbing and flowing like influenza or diabetes. The goal isn't 0 cases. It's preventing needless hospitalizations and deaths. Annual vaccination for the vulnerable. Quick access to treatments like Paxlovid, and a willingness to acknowledge the virus still exists. That's the balanced path forward. So what do you think? Are we witnessing sensible adaptation to an endemic virus, or a dangerous slide into complacency? Should governments relaunch high-pressure vaccine drives, or is personal choice the new normal? Drop your take below. Agreement, outrage, or somewhere in between. The debate is far from over, and your voice matters more than ever.